Hey, this is Dr. Jack Wolfson, board certified cardiologist, and I want to talk to you about 10 supplements for atrial fibrillation. If you are like thousands, if not millions of Americans struggling with atrial fibrillation, you know this is a major cause of concern for you. I get it. I've seen thousands of patients over the years, and I know how atrial fibrillation, the irregular heartbeat, scares people. Number one, they don't like the symptoms, racing heart feelings, palpitations, skip beats. Number two, they don't like the pharmaceuticals used to try and control those. Number three, they don't like the idea of getting zapped or cardioverted or an invasive procedure like an ablation. And number four, they certainly don't like the idea of being on long-term blood thinners. So let's try and reverse this here. Let's talk about how we can get rid of atrial fibrillation. If you follow the paleo lifestyle, you eat the right foods, you get the sunshine, you get the sleep, you get the physical activity, get away from the stress, get away from the chemicals, you'll do very well. But now let's dive into the 10 supplements that we can use that can be effective strategies to prevent and even reverse atrial fibrillation. Number one is the multivitamin. Multivitamin is the foundation of your supplements regimen. It contains all the nutrients you need to get the job done as a foundation. And then we talk about things like omega-3, omega-3 DHA. Omega-3 fish oil is a fantastic way. First, definitely eat the free range, or eat the wild fish, sardine, anchovy, salmon, but you go ahead and take your omega-3 oils along with it. And of course, you can get your omega-3 levels tested. I'll talk about that as we go along. Number three is magnesium. Load up the body in magnesium. Magnesium helps the heart function, helps the electrical system of the heart. Get magnesium into your life. Number four, potassium. Potassium is fantastic for the same reasons as magnesium. Helps the heart to relax. We are deficient typically in potassium, so we want to make potassium a successful part of our strategy as well. Number five, curcumin and other anti-inflammatories. Inflammation is highly linked to cardiovascular disease, so we want to make sure we get anti-inflammatories into our diet, and maybe the best out of all those is curcumin. Lots of evidence, lots of science with curcumin, which is one of the main beneficial compounds in the root vegetable turmeric and one of the Indian superfoods, curry. Number six is berberine. Berberine is tremendously anti-inflammatory as well. Berberine is one of these like super remedies that does so many different things. Up your game on berberine and understand there's evidence on this for atrial fibrillation as well. Number seven is taurine. Taurine is an amino acid-like molecule that helps detoxify the liver, that's for sure, and then also helps to stabilize heart rhythm. That's in the literature. Number eight is CoQ10. CoQ10 is part of the energy cycle in the mitochondria. So if we have good CoQ10, good heart energy, good heart function, lower risk of atrial fibrillation in the literature. Number nine, other antioxidants, vitamins A, C, and E. In the literature, those work for a variety of reasons. Love me some vitamin A, especially when it comes not as beta carotene, but as retinol, palmitate, and retinoic acid, things like that. That's what you want to look for in a quality supplement. And then finally, alpha lipoic acid. Alpha lipoic acid is another one of these superstar antioxidants that you need for your health. And once again, all of these things are in the literature to benefit you for atrial fibrillation. Now, one thing you may want to do is you may want to get tested beforehand. So the three tests that I typically recommend: Vibrant Micronutrient, Vibrant America, and Vibrant Wheat Zoomer. And two of those three tests are on our website. I'm going to put all this into the notes as far as what tests to order, where you can order them from, because it's great, once again, to get all that information. It's one thing to take all these supplements, but how do you know what's going to work for you? Sure, you can try the supplements. I don't see any downside to that, but you may want to get tested and see what your levels are first. It's up to you. Maybe if you're not successful on the supplements, then try and dial it in with the testing. You could go either way on that. I've seen so many people come out to Arizona. So many people are concerned about atrial fibrillation. We get emails, we get requests all the time for this information. So I'll try and keep getting that AFib stuff out there. Also, at the bottom of this post, I'm going to put the supplements protocol along with the links of where to get them on the Dr. Wolfson site to give it a try and see what works for you. There's other great companies that are out there. We've sourced from the best. We're partnering with the best, and I get the experience and success using the products that I am familiar with, and that's the stuff that I sell here. So great information for you. AFib, it's painful in the sense that you don't want to take these pharmaceuticals. You're concerned about using the blood thinners. You're also concerned about having a stroke. I get it. I want to give you the answers. I'm Dr. Jack Wolfson, the Paleo Cardiologist, here to help. If you like this video, click on the subscribe button. And don't forget to share this information with your friends and loved ones because they need it.